Okay, so flying smiles. How did this come about?
How did it come about? I've been a hygienist for over 30 years, and I was working in a rural practice in Aberfeldy in Perthshire, Scotland. And a lot of my patients were getting older, and we used to joke and laugh about how they were going to clean around this implant or through this bridge when they maybe became homebound or were being looked after by carers. And that's really where the idea sort of started, the seed started. I then, through the Hygienist Association, we had a workshop day with Dementia Scotland, and there's a great video called The Appointment by, I think it's by Guy's and St Thomas's for Alzheimer's UK, and it just shows someone with dementia attending the dentist and how scary that is. So that sort of planted another seed. I then went travelling for 6 months with my family, so left my job, and it was like, what am I going to do when I come back? And that's really where the idea blossomed. I just wanted to work within the community and looking at prevention, which obviously since COVID has become so important. So many more people are maybe homebound or shielding than there was. So that's how the idea started.
So I read online that apparently you had this idea sort of came to fruition in March last year, but you didn't actually put it into practice until August. Is that right?
Yeah. I was doing an open day in our local village on the 14th of March of 2019. So obviously it was we locked down after that. So I just kept going with my marketing, and then was when you run a private practice in anywhere in the UK, you have to be registered with the local authority under a healthcare inspectorate guise. In Scotland, it's called Healthcare Improvement Scotland, and they registered me in August of this year to start work. So that's when I started flying.
I mean, and since then, how's it been going? Because obviously, it's. I really like the idea, but I can imagine there are a lot of complications or challenges that you have to overcome when you are carrying out the work. So yeah, how's it been going?
It's been going great, and if anything, COVID has helped, because obviously dentists were working through their backlog. So there's a lot of patients out there who are still waiting maybe to see their NHS dentist. Also, dental hygienists often are in broom cupboards or cupboards under the stairs, so to do ventilation in those rooms has been a challenge, and so therefore a lot of hygienists, especially in Scotland, are still furloughed or not working. So if anything, it's helped my business. So therefore I've been out and about doing it. And also I think people are more open to having something done in their house, whereas pre-COVID it was like, dentistry in your house, that's a bit weird. But now there's an expectation that anything can happen in your house because of shielding and everything. So it's you know, like any business, people have to find out about you, make that decision. You know, obviously I've been a dental hygienist for 30 odd years, so I've attended work, cleaned people's teeth, gone home, so suddenly the whole business side of it is really explosive. And as I say in my workshops, you know, you've really got to think, are you able to cope with that? Is your family able to cope with that? Because it is quite a challenge running your own business and marketing and everything.
Yeah, definitely.
So so I've started there. I spoke to the local carers and started seeing homebound people in the village. I've also done. I went to all the care homes in the local area. And at that point, primary care hadn't been out to them because of COVID. So they were just delighted for someone to come and what I said is, I'll just come as a community gesture and just screen all your patients. So I did that literally with just my loupes, no instruments, and just check their teeth. And then we're able to let the manager know if someone needed dental treatment or didn't. When you've got dementia and you're not able to communicate, it's sometimes difficult to know what's going on. And quite quickly, relatives found out about me, and I'm now doing sort of regular appointments in some of the care homes. So really there to support primary care. Obviously at the moment primary care, again, it's because of people not of the way NHS dentistry is. So I'm hoping to work alongside them and take some of the pressure off them, as it were.
I think you've made a really good point there. I think dentistry, all kinds of dentistry, you never really imagined it to be something that could ever be carried out in a home environment. But as you said, there's a lot of expectation for things to be done at home now, and people, wrongly or rightly, feel safer within their own home because it's, you can't have random members of the public coming through your doors. So I mean, how have you found actually carrying out the treatment logistically? Is it difficult?
No, not at all. Not at all. If anything, from a dental hygienist point of view, it's great because you can say, "Go and grab your toothbrush. Let's have a look at that." Which I used to always have this struggle with reception, saying, "Please remind them to bring their brush in," and also for the patient to remember. So from that point of view, it's great. Obviously, I'm not on a conveyor belt. I'm not seeing someone every half an hour, so I book people in for about an hour and a half if they're a new patient, so that I've got time to set up and unset up. So I have no pressure on time as well, so that gives me time to talk to patients and get to know them and do an individual oral health plan with them. I started off with great big boxes with all the stuff in, but soon realized that actually by the time you've taken everything out, put everything away, so I now have two like toolboxes on wheels, like they would have in a garage. They're metal and you can easily wipe them down, and I have everything in the drawers, so that makes it easier. I literally just wheel my stuff in. My husband comes as my chaperone and sets up my chair. I have a folding dental chair. At first, I started by sitting down and treating people just like we did in the surgery, but quite quickly realised that you never know what surface you're going to be on. And when you're in a surgery, you're all set out, you wheel this way, you wheel that way, you're fine. But I found I was overcompensating with my body because I was on maybe shagged by a carpet and I couldn't get around. So I have I've developed standing up. I now stand up and treat, and I'm actually looking with Victoria Wilson, who is a dental hygienist and yoga teacher, and I are going to do a paper on why do we sit, because actually it is better to stand. I mean, there's the whole thing of standing in your office, and so I find that's the way forward. So I just, on my chair, I have a tray. So I've got a clean box, just like in the surgery, unlock it, lay everything out. And then I've got everything in the drawers. And then part of my business plan was to work with hand instruments to start off with, which fitted in perfectly with COVID. So whereas I was thinking I was going to have to justify why I was using hand instruments, I suddenly could say, oh, it's because of COVID. Not that I couldn't afford.
That's ideal. Yes, perfect.
And then obviously with my following, NSK have been very generous and given me one of their Viva Ace domiciliary kits. And I'm borrowing that for the moment, but I think it's something I can't look back on. I'd like to see what the EMS one is like, but it's great just having air and just having piezo and the professional polishing cup. Is so much. Whereas before I was just using hand instruments and then polishing with the test drive.
Wow, that's amazing. This is incredible that you found that this experience is actually catered and made your job in a way easier than it was if you were in a practice environment. I find that really interesting.
Yeah, no, totally. So I send everything on paper-based paperwork so people know what to set up. I ask them to, just not have too much stuff in the room, and also ventilation. But of course, during these summer months, I've been able to work outside,
That's
which,
ideal.
yeah, which I tell you, some patients have just been real phobic patients. We've set up outside, they've just cloud watched, listened to the birds, and at the end of it, they're like, "Oh, is that over?" You
Yeah,
know.
yeah.
It's been great from that point of view, and obviously ventilation wise, the
Oh,
air exchange is amazing.
can't get any better than being outside, can you?
Yeah. Uh-huh.
A cheap way as well for ventilation, because obviously, you know,
Yes,
those kinds of
exactly.
equipment, that equipment isn't, yeah, it's quite costly. So that's
Yeah,
going to help
but
you.
also, but also because they're in their own house and
Mm,
I'm leaving their own droplets in their own house, and I walk away, and by the time I see the next patient, all my equipment has had its fallow time.
yeah, that's
You
a
know,
good point.
it's
Yeah,
yeah. I'm not. You know, that was my sort of marketing thing at the beginning, was that
yeah,
I leave your droplets in your house. You don't need to go on public transport or sit in a public waiting room or
yeah. No,
wait.
definitely. That's a real selling point, I can imagine, when it comes to attracting clients. I mean, so is this something you are looking to maintain and take forward now, regardless of if there's any changes to the SOPs or things like that?
Yeah, yes, definitely. I mean, what I found is there is a massive need. I'm seeing people that haven't seen the dentist for
Yeah.
years. You know, there is 50% of the population don't see the dentist, but having their teeth cleaned is something else. But I can get in and then advise them to go and see the dentist for this,
Mm,
that, and the other. So there is definite need. There's these huge lot of people who are either in residential care or are homebound.
mm,
So the need is huge. So I do think that it's something that we need to look at as a dental organisation. I know we in Scotland we've got something called Caring for Smiles, which there was a NHS fee for looking after a residential home,
mm,
NHS dentist. But the reality is that to get out and be there versus what you can earn in your surgery,
yes.
it's very difficult.
Yeah.
So you know, in a way, especially dental therapists who can do that much more than I'm just a dental hygienist,
Mm,
you know, it would just alleviate
yeah.
those people.
Yeah,
And I
definitely.
mean, the people that are putting in implants, I saw a lady in her she had her implants done when she was in her 60s. She's now 98. And, you know, do we think about that guarantee for those implants if
Yeah.
someone stops coming to your surgery? And this lady had 2 implants and an implant retained denture,
Yeah.
and she hadn't been able to click it in for a number of years. So
Yeah.
she just balanced it there when she was talking to her
Wow.
friend.
Yeah.
So I was able to organise with the local lab to get it fixed, and lo and behold, click it was
Yeah.
in again, and I was able to check round her implants.
Amazing.
So I'm looking to
Mm,
hopefully build up that as well, to
yeah.
be continuation of care when your patient stops coming to you.
Yeah. No, that's a great idea. That's a great idea. This is what I'm saying. These are the types of things that you wouldn't have discovered there's necessarily a need for if this hadn't
Yeah, yeah.
happened.
I've
Yeah.
learned as a hygienist,
Yeah.
I've learned so much in such a short period of time,
Yeah.
because obviously A, you're on your own,
Yeah.
and B, you're seeing people that you'd never see in surgery.
Yeah.
And you suddenly like, right, okay, how do we deal with this? How do you deal with a dementia lady that forgets to brush, is aggressive and won't let a carer brush?
Mm,
Do you clean their teeth or do you just leave it? You
mm.
know,
Yeah. Yeah.
there,
Yeah.
there's just so much. So I've had inquiries from down in Essex, Northwest
Wow.
11,
That's,
up to
that's not easy for you to get to.
uh, up to Aberdeen. So there's a different need. So it'd be nice to. I see the future of Flying Smiles is that perhaps we'll expand our network, and you know
Yeah.
there'll be a hygienist therapist in various points in Scotland that would pick up on looking after people in their local area.
Well, that's amazing, and I mean, I for one would really like to see that happen. I think that'd be
Yeah,
incredible. I think it's definitely got to be something that expands. There's definitely it's a
yeah,
need not just where you are, but all over the UK, and with COVID as well. It's only, you know, the issues that are going to come up in terms of oral health. They're only going to be get worse, I think, given the
Yeah.
backlog that you mentioned earlier. So yeah, I
I
think
mean,
you're onto something there with that.
yeah, no, and it's all about prevention, really. You know, we're trying to prevent people have more complex dentistry so that dentists don't need to worry about silly little things, but they can concentrate on the bigger,
Yeah.
more complex
Yeah, no,
dentistry.
of course, of course. I know you cycle around. Is that right?
So I'm a great carer of the planet,
Right.
and one of the great things about setting up your own business is you can choose what products you have in your business,
Yeah.
and what you have in your dental shop. So I follow a very sustainable, eco-friendly
Nice.
policy throughout all of that. But within our community, we have something called Strathern Climate Change Group, and we're very much caring for the planet in this little area. So something called Comrie Development Trust had bought 2 cargo bikes about 10 years ago for the village to use, but they'd just been locked away. So I offered to get them serviced if I could borrow them, and they were delighted with that. So there's myself and my husband, all our equipment flying
Yeah,
around
yeah,
the
yeah.
village, on these. I mean, obviously, we don't take them miles away, but just
No,
within our
no.
village area,
Yeah,
we're able to cycle. But it just shows people that you can use things like this to go shopping, to take the kids to school. They're lovely. They're the Netherlands, you know, the one with the bucket at the front,
yes, yeah.
and they're actually designed for little children to sit in, really.
Okay.
Yeah, but so I have a notice on them saying, if you want to borrow this when I'm not using it, please do, to try and encourage the use of bicycles rather than cars for
Yeah.
short journeys.
Yeah, definitely, definitely. And I think, you know, even from sustainability wise, it's excellent, but also it's just such a nice thing to see you probably cycling around the village and going from house to house helping people. It's just a
Yeah,
a
my
nice,
husband and
a
I
nice
have races down the road.
I don't doubt that. I'd do exactly the same if that were me. Well, I mean, that's amazing. And like I said, I think this is a great idea. And when I saw it, my colleague and I saw it online, we thought, I've just got to have a chat with you about this. It's just a great idea. And obviously, you know, you're making such a difference as well at a personal level and just sort of within the profession as a whole. So thank you so much for deciding to
Yeah.
come on today.